Hi everyone, Kathy Schroing here, physical therapist with ReNu Physical Therapy and Wellness. I'd like to talk to y'all today about a topic that's rather personal, a very sensitive topic, difficult topic to talk about. And that is a topic of having pain or discomfort with sexual relations, but also it's related topic of having difficulty finding fulfillment with sexual relations. This is especially a common problem for many women, either after giving birth or for women who have gone beyond a certain age. And so often we hear as women that's like, well, what do you expect? You had a baby. What do you expect? You're 54 years old. And people will often use the words, well, it's normal to experience these things. And I like to challenge that. It's maybe common, a very common problem, but it's not normal and it's not something you should learn to live with. So a few bits of information to help you along is first is to the whys, the why these things are a problem. As can be expected, giving birth is very traumatic, physically traumatic to a mother's body. There's a lot of extreme stretching of the muscles of our pelvic floor. There's often tearing, sometimes cutting. There's stitches, incision lines, and a whole plethora of issues. Complicating that also that during the process of birth, that the pelvic girdle itself, the bony structures, the joints become stretched, and sometimes they don't always go back to their original position. Actually, they usually don't. And those play a strong factor in being an issue causing pain. Any tissue, muscle or any tissue that has been overstretched, has been cut, has had an incision, has a scar. Scars will heal denser and thicker and are not as elastic, and that causes issues and can contribute to pain. The other issues, because there has been a physical trauma to this area, and this is the case not only with someone who's given birth and had some sexual trauma happen to them, that the body responds kind of like a red alert anytime there's any contact with that area. Instead of saying, oh, this is normal, relax, breathe, we're okay. It's like everything tightens up and responds in a hypersensitive way. The other issue is with age-related changes, that there's not as much, especially estrogen, in our bodies, and that causes the muscles in that area to become less pliable, and they don't get as much, I'm going to say, blood flow and as much sensation. So that plays a factor also in all of these symptoms, syndromes, etc. So if you are struggling with any of these issues, please, please, please feel free to contact me and let's talk. Let's talk about the problems you are having, and talk about what are some of your options for treatment, whether physical therapy, whether a gynecological visit or something. Find the relief that you need. Don't just accept it as normal and you have to live with it. If you have questions, want more information, contact me directly by phone at area code 803-216-5140, or you can email me for more information at info@kathy@renupt.com. Oh, excuse me, no, stop, I said that wrong. info@renupt.com, and it's ReNu, ReNu. You can also, if you have any questions or would like me to contact you, just post below here and I'll get back in touch with you. If you are in the area of Lexington, Columbia, in South Carolina, I'd love to have you come in and we can talk face-to-face, private conversation. If you are out of this area but still would like to talk to someone, I would be willing to talk with you over phone, video, text, but I would then try to help to connect you with a practitioner who can help you in your local area, because it's important that you address this and not just live with it. That's just not ideal for anybody. Well, if you have any questions, please do ask, and thank you for watching.